Welcome to the Voices of Hospice Leadership podcast, the show that reveals how to take your hospice to the next level. We cover all things hospice, from marketing and automation to billing and operations. You'll also hear from professionals in the industry as they share their stories of success and practice growth tactics. Here is your host, Brian France.
Awesome. Welcome to today's episode. With me today is Samuel. Samuel shares how family experience led him from the bedside to hospice marketing and the one shift that moves families from fear to clarity. So this is the Voices of Hospice Leadership podcast. I'm your host, Brian France. Let's get into it. Samuel, thanks for being here.
Thanks for having me.
Awesome. For new listeners, how would you describe what you do in hospice today?
Yeah, so as of this point, I'm more of a consultant on the consultant side, but I have a vast background of the hospice world. And so because I've been a CNA at the bedside as well as in the marketing portion of hospice, I've kind of taken my experience and now do some consulting and work with different hospice companies, just kind of seeing how we could pep up what they're doing in their marketing and just kind of go through some leadership and customer service training with the program that I've written, just to go ahead and connect the dots a little bit more, just for those that don't have both sides from the clinical as well as the marketing side, and just kind of bridge that gap a little bit.
Awesome. And what markets do you serve?
So as markets as in just clarification on
Like
on
area.
Oh, I'm sorry. Yeah, so I'm actually in South Carolina, and so I'm over here in the upstate of South Carolina, located in Greenville. But we serve all the way from one end of the upstate, which is would be Cherokee County, all the way down to another end of the area over here at Oconee County. So we have it's a really large but yet really small area over here that we cover.
Awesome. Thanks for sharing. So let's rewind and talk about like what first put hospice on your radar.
Yeah, absolutely.
Think about it, your grandfather needed hospice, right? What did the team do for your family that stuck with you?
Absolutely. So just like you said, my grandfather, we found ourselves needing in the situation that my grandfather needed some hospice care after an injury that he had. And it was a very sudden discovery of cancer and asbestos. And they basically said he didn't have long to live at that point. And with it being such an abrupt injury and situation, none of us, it wasn't a thing that we prepared for. He was still out working on the property and taking care of his day to day. And they recommended to my granny a company to go ahead and interview and talk with. And so she was able to do that. And pretty much immediately, the way that the hospice team surrounded the entire family, but specifically my granny, was just amazing. And so they were in Arkansas. And at that time I was living in Idaho. And so we weren't there, in the day-to-day in the trenches. And so knowing that there were people there caring for my granny, caring for my papa, that just meant the world. That we knew that she needed the help because she was also older in age already herself. And so she couldn't possibly take on that whole responsibility by herself. And so the way that the team came in and surrounded her, it made an impact for me. I was a 15-year-old knucklehead, and for it to make such a drastic impact on me, it was a pretty big moment in my life.
Awesome. Yeah. Yeah, all the stories that I hear, and my wife worked in hospice for a long time, and heard a lot of stories. The team really does come together and support the whole family, and love that. So you became a CNA before graduating. What changed in you during that time?
Yeah, so the way I kind of stumbled into becoming a CNA, my dad kind of recommended it, was picking my brain on what I wanted to do after I graduated from high school. So at 16 years old, he was kind of nudging me on a couple different things. So why don't you become a nurse? There's not a lot of male nurses out there. And I said, well, I could get my CNA license. I can do that while I'm still in high school. And graduate, with a CNA degree or certification, as well as my high school diploma. And so, we came up with a plan. It was perfect. And I jumped right into it. And pretty much immediately I fell in love with the care aspect. I was raised with some special needs foster brothers. And so I already knew how to care for people. And so it was really just growing on that experience that I already had and caring for people that needed help the most. And so it really just drew me into the medical world, and just any way that I can help somebody, I want to. And especially when it comes to, a CNA portion, people aren't expecting to need help like that. You're not 40, 50, 60 years old expecting for somebody to have to help you with the restroom or your shower or getting dressed. It's not something that we plan for. And so, I knew that helping people in the most vulnerable states of their life was something I wanted to be an impact and be part of. And so it really just impacted me in such an amazing way and catapulted me into wanting to be in the medical field for a long time.
Love it. So that early experience still informs how you show up today.
Absolutely.
Yeah. So you've sat on both sides, the clinical and growth side. How did CNA work shape the way you talk to families today?
Absolutely. So, just being able to, speak from the clinical aspect and just, been in the trenches, kind of, what the pain points are for these families and for these patients are. Because really, I didn't start in hospice immediately. I did rehab, and I did med surge. And so you're dealing with people that, normally a little bit more involved, and they're wanting to get up and move around. And so you kind of learn how to navigate people and almost talk people into doing the care that they need to do. And so just kind of taking that and marrying that into the hospice world, and just being able to explain to them, I understand that this isn't where they want to be, but this is where they are. And just kind of navigating that whole premise of just like, I'm here to help, and it may not look the same on day one as it does on day 20 or day 40, whatever that is. And so just meeting your patient and the patient family where they're at. I've had a lot of situations as a CNA, as a hospice aide, where, maybe we didn't do a shower for the first month because we needed to build a little bit more rapport. Maybe the wife or the husband wasn't comfortable enough to relinquish that over to me quite yet. But after we bridge that gap, we build that trust, then at that point they see that I am there to support them and to help them in any way. And I've had patients that I've been with for 6 months and never once did a bad. I didn't do any personal care, but I did everything else that I possibly could just to be there and be a support. And so, whatever that looks like, it's really just meeting the family and the patient where they're at in that journey.
Love it. Coming from traditional sales, what did you have to unlearn to be effective in hospice marketing?
Really just having any expectations at all. It's, every situation is so different. I did car sales for a little blip of my career, and people are coming in for a car. They're coming to you, you're just saying, hey, this is what we got, this is what we don't got. And you just kind of, it's a little bit more black and white. You still have to navigate needs and wants and all that. But when it comes to hospice sales, I mean, it's a very emotional time in people's life. I've told you when we talked before, there's 2 times in everybody's life that we have no control over, and it's when we're born and when we die. And so it's a very emotional time when we're on the ladder of this. And so just being able to take any expectation of the situation I just got done with, I just maybe got another person to come on with our services, take all that I just did and throw it out the window, because every situation's different. Everybody's had a different experience with hospice. And so it's really just about taking that moment of just, hey, I'm here to serve you and your needs. Like I said before, meet you where you're at, and we can go from there.
Awesome. Being salesy, right, is not, it sets you up for failure in hospice.
It really is. And we talked about that, being a salesperson with hospice it doesn't normally correlate to very good experiences, mostly for the families. A good salesman, when you get given a good sales pitch. I mean, when, man, I crushed that conversation. I know that, without a shadow of a doubt, this is the right thing. And, I did great. But what does the family feel on the other side of it? And that's the biggest thing with me, is just I'm not going to tell you all about hospice until I learn what you know about hospice. Let me not assume you know exactly what hospice is all about. So tell me first where you are starting with your understanding with hospice. And then from there, I can elaborate or I can debunk, different myths about hospice. And, there's so many myths. And, I listened to, your most recent podcast that you released, and that's one of the biggest things. There's a lot of myths out there about what hospice is and what hospice does, and the services or the medications that are offered. And it's funny, even with my own family, I have a grandmother on hospice right now currently. And, I've been in this field for over a decade, but yet I'm still educating my own family on, what it is, and having to, paint the full picture of what it is. And so it's really just, allowing it to be a heartfelt situation, a heartfelt conversation. And that's what people feel. They can feel when you're being phony, and they can feel when you're being genuine.
Yeah, I love that. Let's demystify what families fear most. And so in a first meeting, how do you quickly gauge what a family actually understands and maybe what they fear about hospice?
Sure, absolutely. So the first thing is obviously, like I just said, just listening, be an active listener, and then ask clarifying questions. When they're saying, oh, you're not going to give my mom a bunch of medications, are you? Well, what do you mean by medications? Or you're not going to take a bunch of medications away from her. Well, tell me what that looks like. What medications are you thinking? Because sometimes, and this is my own experience just recently with my own mom, we're talking about my grandmother, that, she's on a bunch of vitamins. Do we need to be on a bunch of vitamins right now? Is that the most beneficial thing, to swallow a bunch of vitamins, or can we condense that a little bit? Can we get rid of certain things that aren't as beneficial? And, as hospice providers, we understand that, there are some things that just, they're not adding too much benefit at this point. And so it's all about, let's alleviate, different portions of, just to help somebody be more comfortable. Because I don't mind taking pills. I'm kind of a goofball where I can take a whole handful of pills and not think twice about it. My wife, on the other hand, she's the complete opposite. She has to take one little pill at a time. And if it can't be broken in half, then, we have some issues. And so, that's how, just imagine being uncomfortable anyways, and then somebody's giving you a bunch of extra things. And so things like that, it's just really allowing them to, hey, just talk to me, explain to me what you're thinking. We talked about the morphine and Roxanol, it's, what is it that scares you about this? And explaining and just, saying, hey, I'm not the nurse, I'm not the physician, but from my experience, this is what those medications are for, but that's not something that we got to cross that bridge right away. But that's, it's definitely a big hurdle. Everybody knows, a lot of people think of hospice as, we're the death angels and we're coming in pushing all the crazy medications, and it's the furthest from the truth. If you ask most hospice providers, that's the last thing that we want to end up doing. That's the last thing we want to offer, and it's only offered upon a true need. And when we get to that point, we cross that bridge. There's a time and a place for it. It's not just an automatic, you get morphine, everybody gets morphine kind of a situation. And so it's really just allowing them to feel that and to see that and know that we're being genuine when we say these things. We're not just saying it and then next day we're giving mom, some morphine. And so it's really just, taking their concerns and being able to debunk those concerns as much as we possibly can to allow them to feel comfortable. And a lot of times I like bringing nurses with me. I've been, fortunate enough to be able to have some clinical liaisons that have worked with me, that have worked on my teams. And so I bring those nurses with me. And so from the clinical side, I don't wear a white coat. This beige coat is beige for a reason. I might play a nurse on TV, but in real life, I know what I'm talking about. But it's different when you have somebody with the white coat on, somebody in the scrubs, that can sit there from the clinical aspect and be able to clarify a lot of those things, even as simple, not say simple, but even as, coming down to like a DNR, there's a lot of people scared about what a DNR looks like. And so I've obviously done a lot of codes, being in the CNA world. I've been part of a lot lot of very traumatic experiences when it comes to that. And so, but I had one of my favorite nurses I worked with that would come on my marketing calls with me when I was an account liaison. She painted a picture of what CPR and not having a DNR is in place. She painted a picture so clear that I basically have stolen her talk and stolen that portion of what she talks about, just because it's a very raw and real depiction of what the possibilities are, because it's not what you see on TV and it, you do a couple chest compressions and they come back to life and everything's great, especially not when you're the age of most of these hospice patients and the frailty of a lot of these hospice patients. And so it's really just being able to take those concerns of all the different levels and being able to debunk them. And something that I love to say to a family is, at the end of the day, give us 30 days. Hospice is not a contract. You can fire us at any given moment if you're not satisfied with what's going on. So give us an opportunity. If you don't like us in 30 days, not a big deal. Go ahead and tell us, to kick rocks, and we'll keep it moving. And you don't have it happen very often when somebody just isn't happy with what's going on. There's normally an issue that, maybe a service failure or something that you got to work through. But most of the time, most people, they see the benefit within 30 days. Right here in the moment, you're scared, you're nervous, you're overwhelmed, but give me 30 days. Give my team 30 days to come in. You're going to love my CNAs. You're going to love my chaplains, my social workers, and my nurses. Give us an opportunity to love on you, love on your family members, and we'll be able to prove to you how beneficial hospice can be.
Yeah, I love that. Experience it for 30 days and see, it's not a contract. You can end it at any time, if you're not happy. Love that. What's your go-to way to reframe the Grim Reaper morphine stereotype and focus on quality days?
Yes. Yep. So, definitely, I always like to, tell people, at the end of the day, only the good Lord knows, the exact number, the quantity of days that we have, but we want to come in as a team and make sure that they're quality days. And so it's our goal that every day is the best day we can possibly make it. And, there's some people that, they'll say stuff like, well, no, they got some unfinished business. They want to go on one more trip, or they want to go to the family reunion, or different things like that. And I've been able to be part of so many great opportunities where, we've been able to get people to those moments and get to those big milestones that they want to do those things. And just a quick story. I had one of my first hospice patients, my first round of being a hospice CNA. I walked in and this gentleman was on his deathbed. I mean, the doctor gave him about 2 weeks to live, and it was bad. He was in really bad shape, and pretty much right away, I asked him, so what is it that I can do? What is it that's got you so in such unrest? And he said, well, I just want to walk again. I just want to go from here to the bathroom, and I just need to do that. I said, well, let's do it then. And so we started sitting on the side of the bed. In another week, we were standing at the side of the bed. Within another couple of weeks, we were walking to the bathroom with assistance, and all these things, to the point where at some point I had him doing laps around the building, and my nurses were like, you got to stop. He's not going to be hospice eligible if you keep going. And it come to find out, there was a big family reunion that was coming up that he really wanted to get to, and he hadn't seen that portion of his family in some years. And so that was the goal, was to get to that big moment, that big monument. And so we got him up and walking, and he had a portable oxygen tank and was using his rollator, and he got to that family reunion and he got to hug everybody and see everybody. That was on a Saturday. On Monday morning, when I was on the way out there, his wife called me in a frantic and said, he's not doing good. He's dying. And as soon as I got out there, he had passed away. But it was knowing that we got to that moment. That was the milestone. What can we do to get you to that milestone? If it's to, you want to go fishing one more time, well, let's get you to fishing one more time. What can we do that gives our patients hope? Hospice is not a death sentence. It's hope. It's reassurance that you've got people, you've got support. And, we don't want people to, hospice isn't giving up. We aren't giving up on you. We're coming in and we want to help you have the best, quality of life that you possibly can, no matter how many days or how many months it is. Or if you graduate from hospice, that was something that was brought up on your last podcast. There's people that graduate from hospice all the time. And, it's amazing. Like your last guest said, when you're giving people that kind of care, that's good. Like we hate to lose you as a patient, but we're happy that it's because you graduated. We're happy because you're able to come off of our services. And so, it really is the goal to give the best care. Even though I borderline got this gentleman to no longer being hospice eligible, I saw the bigger picture of this was the need, this was the want and the goal. And he was able to fulfill that. And his wife couldn't stop thanking me for helping him get to that point. And it wasn't anything that I told us. It wasn't me. It was him, because he had to be the one with, his ailments to get up and move and do. But just to be a support and to be an encouragement, because sometimes that's all people need to hear is that, no, you can do it if you want to. And I'm going to encourage you and help you as much as I can. But it's just like our kids, right? Like we got to encourage them to do things at times and allow them to understand they have the superpowers to be able to do that. We can also do that with our patients and their families as well.
Love that. Yeah, being there to support him, that was a wish he had, and to be able to support him, that felt great. And hopefully that made him or helped him pass peacefully as possible. Yeah. But yeah, I think doing that, accomplished that. So awesome. Thanks for sharing that.
Yeah, absolutely.
You use the hospice bank account analogy for the Medicare benefit. Can you share that briefly?
Yeah, absolutely. So I'm not going to take credit for this. I did definitely steal it from one of my account liaisons that I worked with for several years. And when I heard her describe it like this, I was like, that makes such perfect sense. So as most people listening know and understand, the hospice benefit is something that the government has always got right, no matter who's been the political leader or who's been the president, whoever's running Congress. Hospice has always been correct. It's always been there to provide that care for people. And so just describing and explaining this to these families, early on in these conversations of you have that hospice benefit because if you've worked and you've made a check, you see that little piece on their paycheck that says Medicare. Yeah. That's what you're paying into. That's part of what that money's going towards. And so when it's like a bank account that you can only access when you are hospice eligible for those services. And so that money's been set aside just for that care. And what the government does is Medicare estimates how much it should cost for a patient from 0 to approximately 6 months. If there was no treatment, no life-altering treatment given to a patient, then at that point, that's about how long that money should last, through about 6 months. And so just describing it in a little bit more detail, when people think, oh, it's a bank account that I'm withdrawing from now, and it's something I've been paying into, and it's a benefit I've had, because, the last figure that I saw was years ago, there's about 55% of Medicare eligible patients never utilize those services. I believe it's a little higher than that. I think it's closer to about 65% nowadays. I think it's increased significantly. And that's kind of heartbreaking because, from somebody who's been in the medical field for over 18 years and somebody who's done hospice for over a decade, that means we're still not doing a good enough job with these kind of conversations, with educating mostly not even just the public, but not educating our providers, our medical teams, because those are the people that are going to guide the patients and the public into the hospice services. And so that means that that's a large population of people that still are not utilizing those services that are available, and they're free because you've already paid for it. Right. And so you got a lot of people paying for like home care and private sitters and buying medical equipment off the Facebook Marketplace and wherever else they can get it. And it's like, these are things and options that are available to you from that Medicare bank account, that is that hospice bank account, that hospice benefit. And so it's really just describing it in full and just being able to kind of lay that out there like, hey, no, it's not going to cost you anything. Matter of fact, you already paid for it, so let's use it.
Yeah, love it. It's just clear language, you can share with
Right.
your people you come in contact with.
Exactly.
It's awesome. Um, you make a crucial distinction I think our audience will appreciate. How do you move families from eligible to ready without any pressure?
Yep, absolutely. So that's, obviously most of us hear that in the hospice world, mom, mom's not ready, dad's not ready to go on hospice. And so it's at that point, it's like, well, it's not about being ready, but it's about being eligible. And so none of us are really ever ready to go on hospice and to, some people not understand that we're mortal. I mean, we all want to live as long as we can and do all that we can for as long as we can. But at some time we all realize that we are a little bit more mortal than we want to be. And so it's not about being ready, it's about being eligible. And so if we can go down through the checklist and we're checking the boxes, and at that point you can say, hey, well, is this going on? Is this going on? Unexplained weight loss, frequent falls, just hitting the points that aren't as they're pain points, but they're concerns that they want to talk about those things. They don't want to talk about the CHF that they have, or they don't want to talk about those other diagnoses as much as they want to talk about, well, mom keeps falling. Well, okay, well, what about wounds that aren't healing? There's another one. It's picking out those things and saying, well, I believe with my professional experience that this means that mom is probably eligible for hospice. And so if you could get some extra help, what would prevent you from wanting extra help? And also with doing that, within that ready versus eligible, it's also kind of leaning into the family of like, hey, this is not a knock to what you've been doing. You've been doing an amazing job, and you've got mom or dad up to this point, and now it's time for you just to get a little bit of extra help so that you don't feel so overwhelmed, because there are changes that are happening. And so we want to help you with those changes and help those transitions take place a little bit more seamlessly. And so it's really just reiterating a little bit, of like, hey, you're doing amazing, but mom is eligible. This is an eligibility thing. It's not, we don't admit people for being ready for hospice. We admit people for being eligible because we got certain guidelines and standards that Medicare gives us. And so we got to hold those standards, because you can have somebody ready for hospice and they're not eligible. Yeah. And so we see that all the time too, where somebody wants hospice because they know the great benefits of it. And we're like, yeah, but you're just not quite there. Like you're still, those diagnoses aren't in the right spot quite yet. And so, there is a big distinction between the two, and it's a legal distinction for our standpoint, where, with some people, it's more of a, you got to just paint that picture a little differently to the eligible to the ready portion of it.
Awesome. Yeah. Is there a simple tool you have, or, like a checklist or phrasing or question that helps them decide with confidence?
Just kind of like what I said, it's really just about probing and just, it's almost allowing them to talk themselves into it. It's just, hey, well, according to what you've told me, mom's falling, she's got wounds, unexplained weight loss. You just go through the checklist of the things that we know makes hospice eligible patients. And when you say, well, out of these 10 things I just listed, mom's got 9 out of the 10, I believe she might be eligible. And at that point, they're like, oh, wait a minute, and then it's describing the benefits. That's something that, it's people only think about the scary portion of the medications and all that kind of stuff, but it's really just saying, hey, well, are you paying for briefs right now? Yeah, I'm spending $100 a week on briefs. Well, guess what? I can save that $400 a month for you. You want to tell you, wow, hospice, we'll pay for that. We'll cover that. It's just being able to just, explain this is a big portion. It's not just, I'm ready. It's the eligible is going to take care of these other things. And so it's really just not even necessarily having, the collateral that I've used with my hospice companies in the past. We had a brochure, and right the centerfold, it was very intentional, right? The centerfold where the staples are at, and it opens up right to the middle. we had a list of about 10 to 15 different things that make hospice eligible patients. And it's just to kind of trigger those things in somebody's mind. It's like, oh, this does make somebody eligible for hospice. Maybe it's time to give somebody a call. And so it's all about just getting those lists of things together. And if, a hospice out there doesn't have collateral like that, you need to have collateral like that, because the more, people are, you want to hear it, but people want to see it too. Sometimes it takes looking at that list and going back over your mind and saying, oh man, these are exactly what this person's experiencing. Let's go ahead and call and get the hospice on board. It's really just having that together. And that's the best thing that any owner or group can have for their marketing teams, have really good collateral that makes their job as easy as possible, because the conversations are hard enough as it is. But if you have good collateral that they can just say, hey, according to what Medicare says makes a hospice eligible patient, and you just go through the list, then at that point, it makes it a much different outcome for everybody.
Love it. Yeah. So that kind of like a checklist.
Yeah.
See if you're eligible, like see what's,
and it doesn't take long for exactly. Well, it doesn't take long for a sales rep to understand, what those things are. We grasp on. I mean, that's why we do what we do. It's we're the experts at being able to know, because we're the front lines, so we got to know. And it doesn't take long, but it's less for us and more for these families, just to be able to physically see, this is what Medicare says is a hospice eligible patient. And that's what you've just described to me is exactly what this list says.
Yeah. Awesome. Is there a sign that maybe you're pushing too fast, and maybe how you slow it down?
Yeah, and I definitely, I think sometimes, if you're a little too eager, that this is a hospice patient. I mean, they're over there, I mean, you can just look at them and say, oh, this patient's eligible. We can put the cart before the horse a little bit at times. And so, you can definitely, it's all about reading the room. I've always told my reps, read the room. If you walk in, you can tell if somebody's open to listening to what you've got to say. Now, there might be times where, they're looking at you a little crazy, and you just, at that, again, it goes back to what I said in the very beginning, just allowing them to talk. Give me your description of what hospice is. Tell me what your barriers are, and then let me go and try to, get over those hurdles. Because it's a lot harder to backtrack when you just come out the gate and, oh, here we go, hospice, sign the papers, compared to let me ask you all the questions first. Because at the end of the day, most of us want to go home and feel good about what we did during the day. And we know how important hospice is. We know how amazing the benefit is. But at that same token, we want to allow other people to feel those same things. I've been, grateful enough and blessed enough to have seen multiple amazing hospice stories just in my own family. If I don't think about any of my professional career, I only think about what I've dealt with personally with several grandparents, my wife's grandparents. Like I said, I've got my own grandmother on right now. Like, if I look at every situation that I personally had, they've all been amazing situations. And it's been because people slowed down. It wasn't about just getting to the next, as marketers, it's all about getting to the next person. We know that, we got a phone call from the hospital. We've got this person on the 6th floor. We got to go down to the 4th floor and talk to somebody. And then, maybe we're getting a text about somebody in another place. We got to slow down and be in the moment and just really take the time. If they feel that you're rushed and they can feel that you're a little antsy, it's not going to go well. And so I've had where, I've walked in, and it may just be at the end of the day, they don't like the color of black shirt that I got on, but they might like the color of blue shirt that you got on. It's all about what a person's feeling. And if you come in there and you're a little too aggressive because you're just, you got an aggressive personality, it's okay to take a step back, slow down, allow them to speak to you or talk to you. And it goes back to you just feeling heartfelt. They want to feel that connection with you. And especially when it comes to something as sensitive as hospice.
Yeah. It sounds like, sales 101, right? You listen a lot more than you speak, right? Or than you talk. Yeah. So love that.
Yeah.
Clinicians often get very limited hospice training.
Mhm.
What micro training or script, earns clinician buy-in?
Yeah, that's a great question. That's the hardest demographic for a hospice marketer to really connect with is a clinician. If they don't have prior experience, I've been told by several different doctors or nurse practitioners that they're or nurses even their education on hospice is a sliver of what all their training is. So you have a physician and he's the one writing orders, or the PA that's writing all these orders, or even an NP writing all these orders. But they had a week of hospice training and they've been a nurse or a doctor or a PA for 25 years. Well, you're going off of a week or two of hospice training compared to 25 other years of what they've been doing in family medicine or ortho or whatever it is, and they haven't been part of this whole world. And so a lot of it's really difficult to get the time to be able to communicate with those people in the higher positions. And so what I always recommend is, you go into a doctor's office, you're not saying, oh, I need to go talk to Dr. John right away and get back there. You're just going to sit down and have a 30-minute conversation about how amazing hospice is. You got to start by, hey, my lovely lady here at the front desk, and you create that relationship, who ends up getting you the relationship with the nurse that's in the back that may work directly with the physician. So you get to know Nurse Kate. Well, from Nurse Kate, you're talking to her, and maybe she doesn't know much about hospice, and as you're able to paint the picture for her, then she says, my doctor really needs to hear this. And at that point, then you can get your audience with that physician. And then you may schedule these. We schedule amazing lunch and learns, right? As hospice marketers, we schedule amazing lunch and learns, and we have an amazing spread, and we're catering to everybody's diet, and we're doing all these things, and we come in and we're like, this is going to be great. And who do you talk to the most? The nurses and the people at the front desk, because the doctors are blowing in and blowing out. You might get 5 to 10 minutes of a doctor's attention. And so it's just being able to utilize that time, and you go back to the basics of what does eligibility look like for a patient, because many of them don't understand. They think that a patient has to be dying in order to go on hospice, that they have to be in the last days of their life to go on hospice, when we know that that's the furthest of the truth. And so it really is about painting that picture for the doctor, just like you have to the family. You just have to be a little bit more clinically inclined when you're speaking to the doctor. As we know, our physicians and PAs and nurses, they are very data driven. And so the more data that you have, the more you can show, well, hey, on average, patients live, another, 20 plus days when they receive hospice care. And that's just on average. So some people might live 6 months longer, some might live 2 weeks longer, but on average, they're living about 20 days longer than they do without hospice care. And so it's being able to pull up readmission rates. Physicians love readmission rates. They want to know that their patients that they're caring for aren't going to the hospital in the odd hours because of something that they didn't see or didn't do. And so if they've got somebody, hey, if you have anybody coming in that they just keep going to the hospital and they keep falling and they keep coming back in, and a lot of that population, right, it's the people that are going every 3 months to the doctor or every month and a half to the doctor, not every 6 months to a year like most average bears would be going. And so it's just painting that picture of like, hey, this is who we want to have a conversation with. And so once you identify when they throw you a bone and they give you an opportunity, and then you come back, biggest thing with the hospice marketer is do your follow-up. So when you get Thelma on hospice, and you go back to the physician's office and you give them the notes and you tell them, yes, we were able to admit her because of this, this, and this. This is what made her eligible. And that right there will stick in a physician's mind. And then at that point, then they're looking for it. Because then at that point, they know what to look for. And so it's just all about taking what you're doing on a day-to-day, taking it back, plugging it in, and just catering it to whoever your your audience is. Some physicians, they're way more in tune with what hospice is, and that's amazing. And they're advocates, and they're going to throw every patient that they possibly can at you or at another hospice, hopefully at you. But they know what they're looking for in hospice. And so it's being, and at that case, it's taking that partnership. Maybe there's 5 other physicians in the office. It's taking that one physician and say, hey, I've been trying to talk with Dr. Smith. He's just not kind of getting what I'm saying. I haven't, heard anything from him, but he's serving the same demographic as you are. How can I communicate with him? And I'll talk to Dr. Smith, not a problem. I'll go grab him right now. And at that point, then now your internal advocate is going to be the one that goes ahead and helps you take that next step within that same practice or within that hospital group.
Awesome. What's your best partner handoff language that honors the PCP's work while inviting hospice in?
What do you mean by that?
So like what do you use, like the handoff language that you use that honors the primary's work?
Yeah.
Wow.
Okay. Yeah. So you're meaning, I think I'm grasping kind of what you're saying. So it's a lot of physicians too. They don't want to relinquish their care from a patient, and so it's kind of coming back and just kind of like you did with that family member and tell them, hey, you've done a great job up to this point. It's almost kind of doing the same thing with a physician. It's coming back and saying, hey, you've not done anything wrong. This is a natural portion of where they're at, and we can tell that you love and care for your patients, and we know that we see that you want the best care for them, and at this point, this hospice care is what is the best care for them. And so it's really just coming back and just allowing them to see, like, hey, this is nothing that you have or haven't done or haven't seen or didn't pick out. You've done an amazing job. This is just where they're at this point. And so just kind of going back again, like I said, and just make, just allowing them to understand, like, they've done a great job up to this point, but we want to come in as a team and kind of take it from there.
Yeah. Awesome. Yeah. So many of our listeners may be some like owners and administrators. What do leaders often get wrong about field marketers, and what does like trust look like in practice?
Yeah, absolutely. Yeah, that's a big one. That's something that you kind of asked me that question before, that's a big thing. You want to trust your team. When your people that are in the field, they are the front lines. They are seeing it day to day. They're hearing all the conversations. They're talking to other marketers. They're getting a feel of what's going on. I've had, very recently, I've talked to people and they're just like, I don't know what's going on. There's just, doesn't seem to be any hospice patients out there. We're not growing. Like, we know they're out there. We can look at somebody and see, we probably think they're going to be eligible, but then we're not getting referrals, or the people are dragging their feet on referrals. And so when a marketer comes back, now there's definitely a difference on somebody just being lazy and not being assertive enough to be in the field and do all their things and make all the calls. And I'm out there doing my job, but the results aren't coming because maybe there just truly isn't anybody quite eligible yet. And so when your team is saying, hey, they're just not out there, it's a trust but verify, right? Like, I trust you, but let me verify that. Let me come out and spend some days in the field with you. As an administrator, I've had some really good administrators. I've had some administrators that got under my skin a little bit more. But when they said, let me get out in the field with you, I'd love for you to, please, people dread, I don't want to ride along. I want you to come and ride along with me, because I want you to understand and see, I know who I'm talking to. I know their stories. They know my story. They know what I'm offering, why I'm offering. And so I want you to see that I have those relationships. It's not about a relationship issue. It's not that I'm not where I'm supposed to be when I'm supposed to be there. It really just comes down to that maybe there is no eligible patients coming in the door at this time. And so, it's a trust but verify, administrator, owner down to administrator, same thing. I've had a company that they didn't verify, they didn't, they just said, oh, there's no referrals. I don't know. We might need to get rid of everybody. And said, well, get in the field with everybody, come and see what's actually taking place in the field, because just because we're offering an amazing service doesn't mean that everybody's going to jump on, because like say you're a new startup, it takes a while to grow a company for people to recognize that brand, because why are they going to go and jump with a brand new company when they've been using this said name brand for many years and have established relationships with them? Like they love Sam. Sam comes in, we have great conversation, we have a good relationship, but at the end of the day, it's like, yeah, but I'm pretty comfortable with this team that's coming in. So it may mean something a little different than what the numbers are showing. And so it really is about, trust but verify, get in the field with your people. We right along scare some people. I've had some team members that I've worked with that it petrifies them. They freeze, they freak out, and you have to talk them into it for several days, and then they get through with it. And I go, isn't that bad? I actually enjoyed them coming with me. And it's like, well, yeah, because you want your people, you want your leadership to come and to be in the field with you. And maybe you hear something that you've never heard before. I might have been the manager in business development, but my team member that I stole the bank account analogy from, I stole it from her. I'm going to give her credit. I'm going to give her flowers on it. I didn't come up with it. But have I used it for several years after? Absolutely. Has it worked? Absolutely. But it's because I was in the field with her. It wasn't, hey, I don't think you're doing a good job. We're just gonna let you go. It's like, no, let me get in the field with you. Let's see what's going on. I was like, man, you have a better hospice conversation than I do. Let's, how is this, that you're not getting the referrals, and you can, at that point, from the ownership, from the administrator, manager, business development, AVP, whatever your role is, get in the field with your people, come alongside with them, and not just when things are down and things are bad, but do it even when things are good. Because at that point, you have a temperature, you have your finger on who is what. Because you can tell when somebody's phony, you can tell when somebody's not doing their job. When you're not spending any time with them, it's very apparent when things are going south, because they're just not the right person for the fit. But when you have powerhouses that are doing these conversations, having these meetings, get in the field with them. At that point, wait a minute, this isn't like Sam. What's going on? I've heard his conversation. What's changed? Maybe something's changed in his conversation. Maybe he's not probing enough. Maybe he's not asking for the business. Something as simple as go in and you pump everybody up and you talk about hospice and it's all great. And then you don't even say, so based on what we just talked about, do you have anybody that comes to mind? Do you have anybody for me? Those simple little lines at the end could be the difference between you getting a referral or you not getting a referral. And so it's all about trust but verify, get in the field with your people, and know that most of us are in this field. It's not, I've said this before, and hospice sales isn't a sexy job. Nobody wakes up and says, what, I just think I'm going to be a hospice marketer. That just sounds like a hot job. If you want a hot job, there's a lot of other things that you can go do and have one of those roles that you just can't wait to go brag about. Because let's face it, when you tell somebody that you're in hospice sales or hospice marketing, they go, ooh, how's that? That's the reaction you get. Not, oh, you're a pharma rep or a med device rep. Oh man, that sounds great. That's exciting. So it's, most of us want to do well in the field. We're not out there spinning our wheels. Trust that we are there to do the right thing. And it's mostly because most of us have a good heart. When you can join with people that have the same thoughts and feelings and motivations behind everything as you do, it makes all the difference on how you sell and who you sell with out there in the field.
Yeah, I love it. And salespeople, right? They could use like an outside perspective looking in.
Yes.
And it only help them. And great salespeople, right? They constantly are training and working
and even from a management perspective, I had one of my reps, she wasn't doing well, and we couldn't figure out why she couldn't budge past the 4 and 5 referrals a month number that she was getting. And it took one of our AVPs coming in and and really she went and rode, and then she evaluated me. And so even though I know she's doing the right thing, I had to kind of take some coaching too. And it's like, hey, please help me be better, because I want to be the best manager, the best leader. I don't want to be a boss, because bosses are terrible. I want to be a leader. I'm in the trenches with you. When you look good and you do well, that means I look good and I do well. And so it's all about allowing your people to be the spotlight. I had certain numbers I was supposed to hit as a manager. I never hit my numbers because I was constantly throwing my referrals to my reps, because I wanted them to get the benefits and the recognition for doing amazing jobs. And so it's all about just being with your people. So
Yeah. Awesome. What if an agency could fix one thing, say this month, to increase their qualified referrals, what would you pick and why?
I think a lot of it is just, following through on what your people are saying. I think that there's a lot of companies that go out there and they say, oh, I don't know, we can't really do that, or just being available. It's in our local market over here, one of our big hospital systems, they had their own hospice, and they were second on their hospice company was second on the hospital's list, because they wouldn't go see a patient on a Friday afternoon or a Saturday or Sunday. They'd push that referral off. They were too comfortable thinking they're not going to send those referrals to anybody else. And so, it's being available. Our team we had people that were willing and ready to run out. It's not always the marketer. We had our on-call nurses that were they were all about building, all about helping the growth. They knew that the marketers were out there busting their tails and doing all that they possibly could. And so they were willing to jump in and help. And so, it's really just being available for people when they need it the most, and following through. If you say you're going to get them a hospital bed, have a hospital bed there for them. If you're going to order their equipment, they're going to order their supplies, just do it. Because, from an office standpoint, those are the simple things that can be done to help the continuation of care. There's nothing worse than being a CNA or a nurse and getting out into the home. And I was told that this equipment was going to be here, or these briefs were going to be here, but they're not. And then you look crazy because somebody else didn't follow through. So just follow through and empower your team. When my leadership and customer service training that I do, it's all about empowering your team, because when you allow your people to be your strongest asset, they're number one, it helps with your retention rates because they don't want to go anywhere else. And number two, the quality of care skyrockets across the board because you're empowering your people. People want to feel empowered. Now, there's times when people take it a little too far, and you may have to walk a couple people back. But most of the time, if they just feel empowered, they're going to run through walls with you. They're not going to want to go anywhere, because they're going to be loyal to you and loyal to the company, because they know that you've got their back. You show interest in them. You show interest in their growth and their development. And so, doing that, empowering them, being consistent, following up, those are the things that it's not, and they're not monumental changes where it costs you a lot of money. It doesn't cost you a lot of money to make people feel important. It's all about being there, supporting, having the right conversations at the right times, and just supporting your team. So any company out there, big or small, those are the things that people need and people want.
Awesome. So yeah, showing up, following through.
Absolutely.
Being there. Samuel, this was powerful. Where can listeners connect with you?
Yeah, so I'm on Facebook. I'm an old guy, so I still am on Facebook over here. Just Samuel Sotera Powell on Facebook, and then I'm on Instagram. Very limited, but I'm on Instagram. Powell_179. And then also my personal website. LinkedIn, of course, is Samuel Powell as well. That's probably the main way to connect with me. But I do have a personal website for Powell Marketing and Innovation, and that's where I do my consulting through. So if you have anybody out there that would like some customer service and leadership training. This, great conversation was just a blip of what I like to dive into and really just help empower people. I hope, your audience can see my passion behind this. It's about, I love hospice. I love what hospice stands for. I love people, and I love empowering people and helping people become the best versions of themselves that they can possibly be. And so, I'd love to connect with anybody and just help them take that next step, help work out some little glitches. Because a lot of times it's not hard things and hard, changes that have to be done. It just comes down to the basics. And sometimes it takes the outside perspective of getting those basics back in line with your original version or vision of where you want to go as a company.
Love it. Awesome. I'll get those links from you, and we'll make sure to put it in the show description. And Samuel, thank you so much for the time today. And for our listeners, anyone want to be a guest, please reach out. We'd love to have you. And so thank you again, Samuel.
Yep, thank you so much. It's been a blast, and hope your audience gets a little piece out of this.
Awesome. It was powerful. I think they will. Thanks, everyone.
If you're looking to attract more families and share your hospice mission with a wider community, visit hospicecaremarketing.com/schedule to schedule your free consultation with marketing expert and founder Brian Franz. Plus, join our free Hospice Marketing Mastermind group on LinkedIn to connect with other practice leaders and stay up to date with the latest strategies. If you enjoyed this episode, please take a moment to leave us a 5-star review. We'd love to hear from you.